Kenyan President Uhuru Kenyatta is scheduled to visit the Aspen Pharmacare factory in Gqeberha. Aspen produces Johnson & Johnson's COVID-19 vaccines at the plant. Some of the production is destined for other African countries. SABC News reporter Lerato Fekisi is there reporting from the sidelines. Very good afternoon to you, Lerato. Of course, we did hear from the presidents yesterday, President Ramaphosa and Uhuru Kenyatta, that this visit was going to take place. And Kenya is very keen to get on board and produce some of the vaccines itself.
Yeah, very keen to get on board, Nompo, and I think rightfully so, because just looking at the stats in terms of Africa, about 2% of Africans have been vaccinated so far, and I think if anything, this pandemic has shown the vast inequalities in terms of countries getting vaccine, because it has been a scrabble of who can afford, the richest countries getting the vaccines first, and Africa again falling on the back foot. But Aspen, where he's going to be this morning, is going to play a critical role in trying to produce vaccines. In a conversation I had with the group CEO about a month ago, he said Aspen can manufacture 20-25 million vaccines a month, but he also did say that what's more important for them now is trying to secure a license, because the moment you have a license, you're able to stipulate exactly where the vaccines go, because currently most of the vaccines produced here are going through European countries, and only from October onwards did they say what they produce is going to go to Africa. So there is a huge scrabble for vaccines right now, especially with the anticipated fourth wave. But joining me this afternoon is Professor Paul Watts, who's a researcher at NNMU, to unpack more the issue of vaccines in Africa as well. Obviously, Paul, Aspen producing the vaccine is good for Africa, and we must celebrate that they're doing a good job. But the key focus now is trying to secure a license, because a license allows you to produce more vaccines and stipulate to where they go. And perhaps that must be the conversation that the president must embark on this afternoon.
I believe it's absolutely essential. It's evident when you look at what's going on in Europe at the moment. The companies are saying that they want to start making a profit from the vaccines, and unless the continent can secure a supply chain, it's going to be harder and harder to actually ensure that everyone is vaccinated. And as you see at the moment in the developing countries, after sort of 6 months, the immunity is starting to wear off slightly, and people are now being given third jabs, which is also going to reduce the supply chain of European supply coming to Africa.
But obviously, Paul, with the success of Aspen is just doing what we call the fill and finish. So we're not actually producing the vaccine ourselves. And getting a license, although it is the talk right now and the proposal by Aspen, it really isn't that easy, because there's a lot of finance and dynamics to get to that point.
Absolutely. I'm really optimistic that I think Aspen will be given a license to do it. You hear the international companies talking, and they seem to be happy that other companies in the developing world use the patents license-free, etc., etc. So I'm really optimistic about it, but it really will be a significant development. And generally, we need to ensure that sort of local supply of drugs is in all sorts of areas, not just COVID.
And obviously the president is here today, the Kenyan president is obviously here to try and make sure that Kenya become producers as well. Of all the African countries, do you think that Kenya and South Africa stand a good chance of being given this license, and why do you think they must be on the forefront in producing this vaccine?
I believe so. I think these are two countries that have got fairly strong formulation capacity, so at least they're in the sort of drug space already. They're not starting from complete scratch. Aspen now has the skill to actually formulate the vaccine into a finished product, so they've done half of it already. So hopefully, if they can do that first manufacturing step, it will mean that they'll actually be able to increase the number that they can produce each month.
And then lastly, Prof, when we're looking and we're speaking earlier on, we're saying that only 2% of Africans, that's over 730 million people, have been vaccinated, which is actually quite alarming. So how important would be this tie or this unit between Aspen and Kenya play in trying to speed up what really is a disaster for Africa at the moment?
Look, to be absolutely honest, it's probably happening too late, but let's be realistic, things take time to actually sort of get up and running. But you see more and more people needing third doses, so we'll need even more vaccine doses going forward. So this really is imperative that the countries work together to try to push this type of scientific development forward.
Well, that was Paul Watts from the University of Nelson Mandela, just speaking about the importance of this meeting between Kenyan President and also Aspen. They really speak about the importance of these countries coming together, saying that they both are on the forefront, developing in terms of the medical space. And he says he believes that the capacity they do have to produce vaccines, and they should produce vaccines, because Africa is currently on the back foot in terms of vaccines. So we're yet to see exactly what comes from the meeting. disappointing, but he's hopeful, he's optimistic that something good will come from this, not only for South Africa, but the African continent as a whole. For now, let's go back to in studio.